very good morning. May I please request that we try to take the next empty seats in front of us so that we leave the empty seats at the back for the latecomers. And for those of us who are here on time, because come to think of it, a woman in labor does not know when when the child will pop up unless when the child decides to come. So can we just do that? Yeah, for all the mothers in this room that are very much alive today. Thank you. I'd also like to say a very good welcome to participants online. We hope that we'll run through seamlessly without wasting any time. At this moment, can we please all rise for the national anthem? Can we have the national anthem, please? I thought I asked for the national anthem, please. Let me apologize sometimes. Thank you very much. While we're still standing, I'd like to call on the representative from Kano who would lead us in the Islamic prayers. It's very important that we ask God for divine intervention, especially as we all know that it's Ramadan, the holiest of months.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على سيدنا محمد وآل محمد وسلم. May all that we are going to deliberate here be useful to the good people of this country. May Allah subhanahu wa ta'ala bless this congregation. Allahumma inni as'aluka bi anna lakal hamd la ilaha illa anta ya hannan ya mannan badi'us samawati wal ard ya zal jalali wal ikram. يا عليم يا حليم يا كبير يا غفور يا رزاق يا واحد القهار يا ذا الجلال والإكرام سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين.
Thank you very much. Please be seated. Our chairperson for today, Her Excellency Dr. Amina Abubakar Bello, First Lady, Niger State, my own very, very special person. The director from the Federal Ministry of Health, immediate past wife of the Senate President, and of course, recognized in her own person, Her Excellency Toyin Saraki, who will join us any moment from now. Medical professionals here present, very important that you come first. The first 5 of the dignitaries that I want to recognize this morning. And please, can we just give a round of applause to all the medical practitioners in this hall who continue to save lives of our mothers, our children, our brothers, our sisters, our aunties, and the list goes on. I'd also like to recognize that today we have in this hall states from people from Kano, Niger, and Lagos. And so I'd like to recognize all the leads from these states. And please, can we put our hands together for all of them that are here to make history and be part of this historical moment. I'd like to recognize especially because I'm sure what we're doing today is very, very, very important to what they do as professionals. President of Sogan, Dr. Habib Sadoki, you're welcome with your team. I think the Sogan members deserve a very loud round of applause. I'm sure for us women, I'm not sure about any other person, but for me, I still remember those episiotomy that I still remember. It's like yesterday. So when I see Sogon, I'm just so proud of what they're doing. We also have here with us members from the National Hospital, particularly the nurses. They are so important. Usually they're the first port of call before they call in our, the experts, the doctors and the Sogon people. So I know that we have Dr. Zara here, who is also part of Sogan, but I want to say leading the National Hospital Park, wonderful nurses of Nigeria from the National Hospital, doing so well. I have my sister here from England. She's also a nurse and a midwife, and she's very interested in what we are doing because she wants to come back home. So on behalf of your director, deputy director from nursing, from National Hospital, I want to say a very warm welcome to all the nurses and particularly all the midwives in the hall. Can we please give them a special recognition? Members of the academia and of course researchers that are here, it's very important. I'd like to take out, not because she's a woman, because you all know that I'm passionate about what women do, but the fact that she has been very consistent. And for me as a journalist, I would call her from Kano, I will call her wherever she is. I want to have an interview with her and she's ready. Please welcome with me Professor Galadanchi, actually the first person to administer this medication. Thank you very much. Yes, smiles for mothers. What a day to smile. And I think it's so important. I wish we could smile because when you check the data of how many women die as a result of complication from pregnancy, or from PPH, then you begin to, when you smile, then the smile, is from here, it's from within. So the director smiles for mothers who, in spite of everything that went on with COVID, that the world had to cope with, still stood firm to, envelope all of us here in this room today. The director smiles for mothers. Are you around? Please, would you stand up for special recognition? And he's a guy, so that's what interests me. Bless you. Now, I would like to recognize all our partners here, WHO, IDA Foundation, MSD, UNFPA, and various others that are here. God bless you for coming. Special recognition also to participants online. Thank you also for being here. I'd also like to recognize members of my own constituency, who I'm sure will give vibrancy to what we are doing today in terms of visibility that is needed, that should accompany what we are doing today. As we speak and gather here, I'd like to thank members of the vibrant Nigerian media who are here with us. Now, seriously, as a country, as at the last check, which is about 5 minutes back, the statistics or the rate still says 576 women per 100,000 live births die in Nigeria. We actually have a very wonderful stand on that. It says we are the 4th largest when we speak to maternal mortality in the world. So why won't we all be happy that today, on behalf of all of you, an exciting moment, we're here to witness the launch of the first use of heat-stable Carbetocin in Nigeria and sub-Saharan Africa. Because you say in every 4 or every 10 blacks, I can assure you that about 4 or 3 of them will be Nigerians. So we're standing in here for the rest of the Black world. And I'd like to say that I'm excited to be part of this history making. And just before we do anything, let me just state here emphatically, this is not a brand launching event. We are celebrating an innovation of a new thing recommended by WHO for the prevention of PPH. It is heat stable, that is, it does not require cold chain. So even if you take it to the hottest part of Nigeria, it will still be potent and it can still be used. So together, I think that this is something we need to celebrate. So can we all together please put our hands together for ourselves, for what we are witnessing today, and praying that it will move fast, not just from Lagos, Niger, or Kano, but to every nook and cranny of Nigeria where mothers would need it and when it is needed. So again, put your hands together for coming and being part of this. So at this moment, I'd like to invite the country director, MSD for Mothers, who would give us an opening address and would fast track as much as possible to ensure that we all have a good day here today. Yes, and coming to, this is an exciting moment for me. I'll leave her to talk about it. Yes, please come on. Yes, because this is like, this is my daughter. Yes. So please, can you just give us a welcome address and tell us a little bit? Yes.
Thank you, Auntie Moji. Her Excellency, the First Lady of Niger State, Dr. Amina Abubakar Bello. I am a family member because my name is Susan Bello. And I worked in Niger State the last 2 years of my life on a USAID project targeted at reforms and revitalizing the water sector. So, Muyengidani. All development partners here present allow me to stand on existing protocols. Auntie Moji is my mother in the trade. My background is in broadcast media, and they were the ones that showed us the way. So my background in broadcast media, in development, health development, community participation, all stem from looking up to role models like Auntie Moji. Thank you so much. I am representing as country director, MSD for Mothers, Iyadini Olubode, whom some of you know as the country director, is away on maternity leave. How else to show love for maternal health and all that we stand for at MSD for Mothers? Mother and baby are doing very well. So it is a pleasure to be with us all today on this historic day. My name is Susan Bello. Like I have said, I am the interim country director for MSD for Mothers, Nigeria. Our company's global initiative to help create a world where no woman has to die while giving life. I'm honored to be speaking to you today in recognition of this important milestone, the official launch of the heat-stable Carbetocin for PPH prevention in the public health sector of Nigeria. In fact, in sub-Saharan Africa, with intention to provide broad global access. Every single day, there are roughly 385,000 babies born around the world. This is a UN statistic. More than 800 of these women welcoming these newborns into the world die from preventable causes related to pregnancy and childbirth every single day. Now, each one of these preventable deaths is too many. Unfortunately, as we are well aware, Nigerian women and the healthcare system that seeks to care for them suffers an oversized portion of the global burden from postpartum hemorrhage. Many of these women experience excessive bleeding after childbirth, a life-changing postpartum hemorrhage that should be prevented and should be treated. To help tackle the global maternal mortality crisis, we are humbled and proud to have joined forces nearly a decade ago in a public-private collaboration with the World Health Organization and Ferring Pharmaceuticals to catalyze accelerated recognition of heat-stable Carbetocin as a new alternative for the prevention of postpartum hemorrhage. When we started on this journey, we listened to the global maternal health community, and we heard the need for innovation in the prevention of PPH. Our collective action brought together the expertise of each of our organizations and many other experts from around the globe to translate evidence into access, clinical practice, and ultimately positive outcomes for women and their families. We are honored to be a part of today's celebration, and we're excited about the program and the progress underway with efforts that are focused on improving the quality of maternal health care and strengthening the response to PPH in Nigeria by way of our Smiles for Mothers initiative, led by the Solina Center for International Development and Research, SIDA, with other development partners. Today's milestone is particularly timely in Nigeria with COVID-19 pandemic, among other priorities, which is putting a strain on the health system and threatening to upend the years of progress to address maternal mortality. MSD for Mothers remains committed to helping to end maternal mortality through the continued support of educational and advocacy efforts to strengthen government responses to PPH. Our goal is to strengthen the country's response to PPH, which is the #1 direct cause of maternal mortality globally and in Nigeria. Heat-stable Carbetocin is a new alternative that we believe has relevant evidence and characteristics to support this. Our company invents for life, and we hope to inspire more multi-sectoral collaborations to support women before, during, and after childbirth. Thank you all for the support and all of the hard work that went into this. And thank you for this monumental effort. The team at MSD for Mothers is hopeful for a future where this work will continue to save more lives around the globe, because we stand for a world where no woman has to die while giving life. Congratulations once again, and thank you.
Thank you very much. Well, it says it all, and exciting moment why we're all gathered here today. When I had a phone call and was invited to this event, and I asked to see the concept note, for me, the call is that, oh, thank God, we have other things that will help prevent deaths, particularly at birth. I'm very passionate about this because I have witnessed quite a number of women dying as a result of PPH. And as we speak to that, let's welcome warmly Mrs. Toyin Saraki, who is the chair of Wellbeing Africa. Yes, and who is doing everything possible also to ensure that we reduce or contain the deaths of mothers needlessly. So please, let's put our hands together and welcome her warmly. The program continues at this moment. Sometimes it's very difficult to appropriately describe our next person. Humility is what I love, but the fact that her calling is also her passion also makes it very unique. And that's why she's chairperson today. Thank you for what you do in Niger State. Thank you so much. I'm really proud of you. A lot of women, when they become very, very, very important people, they forget their calling. But for her, it was the office has been able to accentuate what she does. Please welcome with me our own proudly Dr. Amina Abubakar, First Lady, Niger State, and chairperson of today's event. Thank you.
A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Her Excellency Toyin Saraki, the founder and present Wellbeing Foundation Africa, and our elder sister in the work that we do as First Ladies. Thank you very much for setting the standard. The country director, MSD for Mothers, Susan Bello, a member of our Niger family. Director of Reproductive Health, Federal Ministry of Health, Dr. Kayode Afolabi. Director for Smiles for Mothers Program, Dr. Uche Ibokiwe, I hope that is correct, and his team that are here. our development partners and other NGOs that are present here, the staff of the Ministry of Health, and members of Niger, Kano, and Lagos State that are here. And I want to especially acknowledge my senior colleagues from Sogon that are here, Dr. Galadenchi, Dr. Habib, Dr. Zara, and the nurses that are here. It gives me great pleasure to be here. Other invited guests, distinguished ladies and gentlemen, very good morning. It's a pleasure and an honor for me to chair a program such as this for a subject that is quite close to my heart. Once you're a gynecologist, PPH has to be close to your heart. And not only because it is the cause of needless death, preventable ones, but also because it is really taking the lives of a lot of women. And it's a problem that it's like it's pervasive. It continues, it never changes every year. The cause of death, maternal death, is always PPH. It makes you wonder why. If we know this is the cost every year, so what is the problem? But one of the reasons why I'm happy to be here is obviously we are working towards getting solutions. And collaborations such as this with MSD and Ferring Pharmaceuticals is one of such ways in which we can actually find solutions. And a heat-stable medication that will really help us with PPH is one of those innovations that is important, and we're happy to be here to witness the launch of such a product. We as gynecologists are looking forward to seeing that this actually works. It is not just something that is going to be launched, but it's something that's going to be practicalized and see a difference in the lives of women. We pray that as we have started this program in Kano, Lagos, and Niger states, we will see a time when it can be extended to the other states in Nigeria and make it a more sustainable thing for the women in Nigeria and in Africa at large. So I want to welcome everybody to this program. We look forward to the presentations to see what we have in store for ourselves with this HSC. And I hope that by the time we leave, we carry a very good message to our states on how we can prevent maternal deaths in Nigeria and Africa at large. Thank you very much. I look forward to the program. And I hope everybody can contribute. I suspect at some point we should have an interactive session where we can get more information if it is required. Thank you so much.
Thank you very much, Chairperson. Your Excellencies, all very distinguished ladies and gentlemen, would move on straight to the next item. And we're going to be hearing from the lead from each of this state that are here represented here today. From Niger, I'll start from Niger State, Dr. Ibrahim Idris, Director of Public Health. Please, can you come over to the podium to address us? Thank you. And Lagos would follow so that we do not waste too much time.
Her Excellency and Chairman of today's occasion, the wife of the Governor of Niger State, Dr. Amina Bello, Her Excellency and the wife of, I don't want to use the former, one-time Senate President, the Director of Reproductive Health, Federal Ministry of Health, the Director Smiles for Mothers, the Director MSD for Women. Permit me to stand on other existing protocol. I'm just going to speak to give a goodwill message on behalf of Niger State Ministry of Health. For us in Niger State, we have embraced this new innovation, and a lot of activities have already been carried out to ensure that immediately after this launch, all women that need this drug will start having them immediately. Let me say that we're most grateful to His Excellency, the Governor of Niger State, for continue to provide conducive environment for us to reduce the poor health indices in Niger State. And again, to Our Excellency, who has continued to champion those good strategies. You know, when you have, I want to use the word politician. When you have politicians that have political will and make everything possible for you to do, I think the sky is just the beginning. Because without their support, without their involvement, we will continue to remain where we are. Good policies will remain where they are. A lot of achievements have already been done. We have achieved a lot with the coming of her and His Excellency. But let me say that this drug is going to be a game changer in the world of postpartum hemorrhage. It means that with power or not, hard to reach or not, mothers would cease to die from PPH. So on this note, I want to congratulate all of us for witnessing today. I want to also plead that it should not remain here. Kanu, Lagos, please, when you get back, also ensure that this drug gets to the nook and crannies of your states. Thank you, and thank you.
Thank you very much, Dr. Idris. From the maternal and perinatal death surveillance and response, the chairman technical committee in Lagos State is today representing Lagos. Dr. Donald Imosemi is here with us. Please, let's welcome him warmly. And with that long thing is MPDSR. Quite a mouthful. Thank you.
Thank you very much. Thank you very much. Our Excellencies, good morning. Let me acknowledge the chairman of the occasion, the First Lady of Niger State, Dr. Amina Abubakar, and Our Excellency too, Mrs. Twin Saki. Let me remind you of the assistance you gave to me when I was the MD of Lagos Maternity Hospital. So your crusade to save mothers' lives just didn't start today. Distinguished attendees, I'm just adopting, the existing protocol. On behalf of the government of Lagos State, I want to congratulate, all the partners here that have made today possible. I have just 2 minutes, but again, it's very sobering to know that in 2 minutes, worldwide, a woman would die of pregnancy-related complications. And in 6 to 8 minutes, when my other, goodwill speakers would have spoken, would have lost one woman, to, postpartum hemorrhage. And so any innovation, any intervention, anything that will help us, especially from the preventive point of view, which is very critical in a sector like ours, where our health system is still very weak. It looks at prevention. I think it should be welcome. Lagos State recognizes this, and that is why it supports it directly and indirectly through the MPDSR program, the technical committee of which I head. The program is just to look at cheap, innovative, and effective ways of reducing maternal mortality. Hemorrhage is the leading cause. And that is why even before now, when the obvious advantage of heat-stable carbetocin was brought to the fore, despite the, in quote, prohibitive cost, the policy in Lagos State is that no woman dies, regardless of the cost, if the solution is available. So for us in Lagos State, we've begun, well, targeted, use of it. With what's going to happen now, we're going to institutionalize it. And what that does mean is that more and more people will benefit from this wonderful drug. And from a very sobering solution, I'm sure that the story will become a very cheerful one. And what's a month? Ramadan period, and then for the Christians. Okay. The holy month.
Yeah.
So thank you once again. God bless you all. Thank you.
Thank you. Thank you very much, and especially for the assurance to ensure that this is sustained, not just after the launch, but getting across to women so that no woman dies from pregnancy-related complications. We're talking about PPH, and I was just sharing with Adebisi, I'm sure, who at some moment had spoken to one of you. When I was at that level, having children, having my kids, I thank God for them. I also went through PPH. I, in fact, had retained placenta. So you know that it's double, But here am I today, a grandmother, because I had quick intervention. I do pray that this innovation would also save more lives like it did save mine, so that together we can build a vibrant Nigeria. We are moving on. I would like to go to Kano, and Dr. Ashiru Rajab, Director of Public Health, is speaking on behalf of our Kano delegates and participants here. Thank you. Can we welcome him warmly?
Your Excellency, the wife of the Governor of Niger State, Hajia Amina Abubakar Sani Bello, Your Excellency, Dr. Toyin Saraki, the Director of Reproductive Health, Federal Minister of Health, the Director Smile for Mothers Project, all other distinguished participants of this activity, kindly permit me to stand on existing protocol. I stand here to bring greetings from the Honorable Commissioner, Kano State Minister of Health, Dr. Aminu Ibrahim Sanyawa, on this laudable achievement for our country. This intervention, no doubt, is going to bring a lot of changes in our maternal statistics. We pride ourselves in Kano as being one of the states that has robust MPDSR structure. And as I stand here, I can observe Dr. Sadoki, the president of Sogon, who has been partnering with Kano State in our MPDSR activities. And we have been battling with poor statistics time and time again. So with the coming of this project, we all started jubilating. We are very excited. And this project started about a year ago, and we've been asking, where is the Carbetocin? But they said we are coming slowly. We went through all the human-centered design workshop, all the co-research, all the co-design, the co-refinement, and then finally, Carbetocin landed. And to cap it all, when Professor Galadanchi administered the first dose in Kano State, then everybody started smiling. We are very grateful, and we hope that our state, in particular, we are going to make sure we sustain this intervention even after the end of the project. Thank you, everybody.
Thank you very, very much. We'll just have a member of staff from the Sheraton Hotels. They have begun a security tip, which they do at every event like this. So I'd like to invite Sheraton to please speak to us. 1 minute.
Good morning, participants. My name is Ali Mohammed, the safety manager at Sheraton Abuja Hotel. It is a tradition in this place. We tell you the safety and security tips as regard the Ladi Pali Hall, so that there will be no cause for alarm during your stay here. However, before I continue, please, in case there's need for you to ease yourself, for our convenience, very easy to get there. As you walk out of this door, turn to the right. At the extreme end there, you see a security personnel. Behind him is the convenience place. Today is not scheduled for any fire. Therefore, if there's continuous ringing of fire alarm bell for 2 to 3 minutes or beyond, that suggests that something might have gone on somewhere. However, you should not be panicked. Be calm. We have trained emergency responders who knows what to do during any kind of emergency as regards this hotel at large. I am not saying this because I'm anticipating any emergency, please. No, don't be panicked. Because as we all know, emergency doesn't ring bell before it happens. So as human, what do we need to do? Be prepared. Please. On the other side, on your personal belonging, sorry, madam. I believe everybody here has a mobile phone. Some have their laptops among other personal belongings. This is a public place. While we have our own responsibility to protect you and your personal belongings, you also have a role to play so that there will be no cause for alarm conflict. We will not disclose our own strategy for security reasons because this is a public place so that the enemies will not know our target. But your own, these are the things that we're expecting from you, please. 1, on no account should you leave any of your items unattended to. All those things are mentioned, your phone, laptop, whatsoever. More especially when you're going to the convenience, coming to the podium to give a speech, tea break, lunch, an individual or group photograph, or whatsoever reason that will make you to leave your seat, please never leave any of your items unattended. If probably because of the weight or whatsoever reason you must leave it, please leave in the hand of someone that you know very well. And who is this person? This is someone that you, 1, have the contact of that person. 2, you know the person's office. 3, you can be able to locate the person's house to give him the item. Anything short of this, we cannot guarantee the safety. Thank you so much.
Thank you very much. Very important security tips there. We are moving on with remarks. And it's important that what we're doing today is endorsed by the World Health Organization. So representing the, I'm sure the WR and is Dr. Bosade Ezekwe, who would be speaking, I'm sure giving an endorsement on today's event. Can we welcome her warmly, please?
Her Excellency, First Lady of Niger State, Dr. Amina Abubakar Bello, Her Excellency Mrs. Toyin Saraki, ladies and gentlemen, permit me to continue on the established protocol. Good morning, everyone, and a happy World Health Day to you all. On behalf of the WHO representative in Nigeria, that's Dr. Walter Kazadi Mulombo, I thank the management and staff of Smiles for Mothers program for inviting us to be part of this important event, and we congratulate you on your achievements. Between 2000 and 2017, the global maternal mortality ratio was estimated to have fallen by about 38%, which showed that we had made some progress. This meant that we achieved an annual rate of reduction of 2.9%, which is great, but it's still a far cry from the estimated 6.4% reduction we need to achieve the SDGs if we want to achieve a maternal mortality ratio of less than 70 maternal deaths per 100 live births, 100,000 live births by 2030. Now, globally, about 810 women are estimated to die daily from largely preventable causes. And the most common direct causes are excessive blood loss, which is the postpartum hemorrhage that we are talking about today, as well as infection, high blood pressure, unsafe abortion, and obstructed labor. And sadly, 2/3 of most deaths resulting from these causes occur in sub-Saharan Africa. Postpartum hemorrhage has and still remains the leading cause of maternal mortality in low-income countries, and it is the primary cause of nearly 1/4 of all maternal deaths globally. About 14 million women around the world suffer from postpartum hemorrhage every year, with 99% of the deaths happening in low and middle-income countries. Oxytocin has remained the first drug of choice for prevention and treatment of PPH, but its requirement for cold storage reduces its potency in low and middle-income countries like Nigeria, where it is needed most. Hence, the Carbetocin hemorrhage prevention, otherwise known as the Champion Trial by WHO, with support from MSD and in collaboration with Ferring Pharmaceuticals. The study conducted in 10 countries, including Nigeria, showed that due to its heat stability, Carbetocin is what is needed in a setting like ours. It is not inferior to oxytocin. So it is heartwarming to see that as a country, we have taken this forward and are making progress to improve access to safe and effective medicines for the prevention and treatment of PPH for our women. Every woman should have a positive experience during pregnancy, childbirth, and the postnatal period, ensuring that her and her baby reach their full potential for health and well-being. As WHO, we applaud the work being done in Kano, Lagos, and Niger states, and we encourage Smiles for Mothers and partners not to relent in your efforts and to continue to champion the cause of women to ensure that we safeguard their lives, because every effort to do this counts. We remain committed to our promise to promote health, keep the world safe, and serve the vulnerable. So once again, I say congratulations. Thank you.
Thank you very much, WHO. Thank you for that statistics that you give. 14 million women. That's a huge, huge, huge number of women dying needlessly. Our next speaker is passionate, founder, president of the Wellbeing Foundation Africa, Her Excellency, our own Inquirer, we call her our own, Toyin Ojora Saraki. Is a global advocate for women and children's health and empowerment with 2 decades of advocacy covering reproductive, maternal, newborn, child, and adolescent health, and doing so many things. I think for the nurses in the house, we must recognize that she is the inaugural and emeritus global ambassador for the International Confederation of Midwives, special advisor and member of the Independent Advisory Group. All this on and on and on and on. I present to you.
Thank you very much, Auntie Moji, and my own dear Yaule from Kwara State. I'd like to say a very happy good morning today to the chair of today's occasion, Her Excellency, the First Lady of Niger State, Dr. Amina Sani Bello, and my own dear sister. Good morning also to the WHO representative, Dr. Bosede Ezekwe, to Dr. Vishal Shah, the Director of Scientific Affairs for Ferring Pharmaceuticals, to Mr. Bhavin Vaid, the Head of Corporate Communications and Public Affairs at Ferring Pharmaceuticals, to Dr. Kayode Afolabi, Director of Reproductive Health, the Federal Ministry of Health, to the Country Director of Merck for Mothers, Dr. Susan Bello, to all executive officers here from the Federal Ministry of Health, the executive officers from the state ministries of Kano, Lagos, and Niger states, executives of professional bodies and associations. I don't want to single out SOGON, but your particular favorite. Frontline health workers, safe birth champions, donor organizations, implementing partners, media representatives, and last but not least, our midwives and nurses that are at the front line fighting to save women's lives every day in Nigeria. I'd like to start off by saying it is indeed a very, very happy World Health Day. And I say that because prior to this intervention coming into Nigeria today, we were always the first or the second largest contributor to many of the world's challenges, particularly as concerning mothers, newborns, and under fives. But hopefully after today, we will actually be able to say with our full chests, as they say in Nigeria, happy World Health Day. My name is Toyin Saraki. I'm the founder president of the Wellbeing Foundation Africa and the inaugural Global Good Health Ambassador for the WHO Foundation. We work across Africa to improve health and social outcomes for women and their children, which is a cause I've dedicated much of my adult life to. I'm delighted to join you all here today to celebrate the launch and mark Smiles for Africa's program of the first use of heat-stable Carbetocin in Nigeria and in sub-Saharan Africa. It's a life-changing moment for women around the world and the global health community as we will actively witness in real time the vital impact of heat-stable Carbetocin, a new formula which does not require refrigeration or cold chain transportation, which are challenges that we have faced time and time again across Nigeria. I've personally been awaiting this major maternal health milestone since the publication of the Champion trial results in 2018, a study led by the World Health Organization as part of a collaboration with MSD for Mothers and Ferring Pharmaceuticals. The data then contributed to heat-stable Carbetocin being added to the WHO model list of essential medicines, as well as an update in the WHO's recommendations on uterotonics for the prevention of excessive bleeding after birth. We all know that postpartum hemorrhage is the leading cause of maternal mortality, morbidity, and long-term disability relating to pregnancy and childbirth, not just in low-resource countries, but globally, accounting for nearly a quarter of maternal deaths worldwide. In Nigeria, we have the added challenge of low uptake of the existing antenatal care services and delivery services, contributing to PPH, with PPH observed to be the most frequently diagnosed obstetric hemorrhage complication. And the majority of women who experience PPH complications have no previously identifiable clinical or historical risk factors prior to this complication occurring. So while improving the overall quality of healthcare is crucial to addressing the high maternal deaths, the use of heat-stable Carbetocin will be revolutionary. Maternal health with thriving mothers and children is the most vital component of healthy societies, economies, and nations. Healthy mothers lead to healthy families and strong health systems. It has a direct impact on the welfare of our society, especially in developing countries, because a mother's death is much more than an emotional crisis. A mother's death leads to long-term social and economic breakdown, both for her immediate family and the wider community. Throughout my years of advocating for improved maternal health in Nigeria, I'm sure there's hardly a person in this room that I haven't come into contact with, or I would say advocated, but you all know I harass you into improvements. We know that one thing is clear: effective interventions to prevent and treat PPH do exist and actually do reduce the burden of this life-threatening condition. I've personally addressed the challenges associated with the lack of access to PPH medication and training and adequate timely maternal health care by developing and implementing programming through the WBFA to improve access to skilled birth attendants, particularly better quality primary health care at the grassroots community level. In partnership with the Liverpool School of Tropical Medicine and Johnson & Johnson, we successfully introduced, implemented, and championed emergency obstetric and newborn care skills training in Nigeria, which takes place in-house and equips doctors, nurses, and midwives as a collective team with the skills needed to overcome obstetric emergencies.
That training uses lifelike anatomical models and simulation case scenarios to enable health workers to develop expert first-hand experience. It has led to a 15% reduction in maternal fatality and a 38% reduction in stillbirth rates, which validates our push to scale this to pre-service curriculum with the denomination of the Kwara State School of Nursing and Midwifery as Nigeria's first center of excellence. However, we all know that prevention is better than cure. And as an ambassador to the International Confederation of Midwives since 2014, we've also recognized the role of midwives as the primary educators and health carers for childbearing women in our frontline programs towards safer births and healthy futures through our flagship Mama Care antenatal and postnatal education program, which actually does, through these free classes, bring the mothers into the clinics where they can receive the care and builds trust between the mother and the carer. So the quest for real and practical solutions to improve PPH outcomes in Nigeria has actually seen us walk the daily path over decades from the research bench to hospital bedsides and birthing stools in huts, from a simple mat placed under the mother to measure the flow of blood to signal to the midwives and nurses when that blood is too much, as a practical signal in 2008, to the oxytocin shot for life, to misoprostol with DFID parts 2 in 2010, to fighting alongside Flight for Every Mother for hands-on training across Africa in 2013, to our 6-year WBFA LSDM J&J program to improve the availability and quality of maternal and newborn care in Nigeria, through to the London School of Tropical Medicine's Woman Trial for tranexamic acid, which is where I actually met Ferrings in 2018, to advocating to the Global Board of Ferrings in the January of 2020, to our partnership with Lurdle Global Health, to improving community midwives' access to modern tools and trainings in the 670 community healthcare facilities, which we are engaging with across Lagos, Kwara, Osun, Cross River, Kaduna, Kano, Sokoto, and the FCT Abuja. So today I want to congratulate Niger State, Lagos State, and Kano State as being the first to run this accessible treatment of PPH through heat-stable carbetocin, because we will be much, much closer to reaching Sustainable Development Goal 3 with our healthcare workers given timely access to appropriate medications and support in the procedures relevant to the management of PPH, and our mothers also being aware and knowledgeable on being their own advocates for heat-stable carbetocin. The fact remains that despite significant statistical improvements, becoming pregnant is still one of the most dangerous things a woman can do in her lifetime in Nigeria, where there is a 20-fold higher risk of death than from better resources of the world. Today, with the entry of heat-stable carbetocin into our arsenal, we are a quantum leap closer to tackling and ending PPH and to leading the world in demonstrating at first hand how working across both the public and private sectors can help to achieve development goals in global health. It is my hope and my prayer that the groundbreaking progress that we have made today will also mark a new era in strengthening the essential medicine supply chain and drug revolving fund management at the primary health frontline, where this matters the most, and to transforming maternal care across the globe with positive impact that will be implemented and accessible everywhere through heightened investment and a stronger commitment to the cause. When we save the lives of mothers, we are also saving families and communities from tragic emotional, mental, and socioeconomic costs of irreplaceable losses. We are also realizing and potentiating an enormous opportunity for human development and a healthy future for all. I congratulate everybody present, and I look forward to much better indices for every Nigerian mother, child, and family. Thank you.
Thank you so very much. we surely look forward to lower indices, most importantly, containing to zero level of where we are today. Our next speaker is important. Himself, an ONG consultant and having worked for over 30 years experience as a consultant. He's been a commissioner for health in Oyo State, currently in his capacity as the director and head of reproductive health division of the Federal Ministry of Health, has been doing so much to ensure that we're here today, and beyond that, to ensure some measure of sustainability when we speak to sexual and reproductive health. I want to congratulate you, Dr. Kayode Afolabi, that you are here today. I didn't recognize you. I was going to ask Professor Galadanchi, please, where is he? Then he now said, okay, Malam is here. So Malam Dr. Kayode Afolabi is our next speaker. You're welcome.
Thank you very much, Auntie Moji. Malam indeed. Your Excellency, the chairman of this occasion, and the First Lady of Niger State, Dr. Amina Abakabelo, Your Excellency, Mrs. Toyin Saraki, all the directors and directorate cadre officers who are here present, along with your team from ministry, department, and agencies. Both from the federal and the state level, the director MSD for mothers, Smiles for Mother, and all donor as well as implementing partners who are here present, the United Nations Agency, the president of my own association, Society of Obstetrics and Gynecology of Nigeria, and all obstetricians and gynecologists who are here present, all experts in reproductive and maternal health, the media, distinguished ladies and gentlemen. I bring greetings from the Honorable Minister of Health, Dr. Sage Hanire, and on his behalf, I'll make a brief endorsement statement for his stable Carbetocin in Nigeria. Lots have been said about our poor maternal health indices in this country. The official maternal mortality ratio for Nigeria stands at 512,000 live births. And by extrapolation, this translates to losing about 58,000 women to pregnancy-related causes annually. By our population of about 200 million, we contribute just 2.4% of the global population. But unfortunately, we contribute over 20% of maternal mortality burden globally. And the commonest cause has been mentioned repeatedly in this hall today, being postpartum hemorrhage. So we are quite very excited for the addition to our armamentarium, a very potent oxytocin agent that I believe will contribute greatly to reduction of maternal mortality in Nigeria and other countries in sub-Saharan Africa. I want to congratulate the Smiles for Mother Consortium, MSD for Mother, for supporting this laudable project. And I quite appreciate the human-centered design that Smiles for Mother put into the introduction strategy of its stable Carbetocin. This has given us as a country the opportunity to look beyond just introduction of its stable Carbetocin, but also to use the project to strengthen the health system. Lots of capacity building are taking place with the support of Smiles for Mother project across the country, particularly in the focus states of Niger, Lagos, and Kano. We started with training of trainers for national trainers, and we've been cascading to service providers. As we speak, such capacity building goes on in these focus states. So, Smiles for Mother, thank you very much for supporting us to strengthen our health system. And I want to further appeal to you to strengthen your commitment in the efforts of ensuring universal health coverage to girls and mothers in Nigeria. We're excited for your good work. I congratulate you, congratulate the government of Niger, Lagos, and Kano State for being part of this. And I want to appeal to all stakeholders, government, donor agencies, implementing partners, to support and embrace the use of its stable carbetocin across the country so that we can decimate maternal mortality and let our women live instead of dying in the primes of their life. Thank you very much. Congratulations.
Director of Health at the Federal Ministry of Health. I'm sure that your message is loud enough, but we keep speaking to everyone until every state, including the Federal Capital Territory, keys into this innovation. And let me just assure us that it is also NAFDAC certified, because we have NAFDAC here represented. So no fears at all going forward with this medication. At this moment, let's just relax a bit as I call on the Mansu, who would give us some spoken word. Please, let's welcome her warmly.
Good morning, everyone. I'd like to, first of all, congratulate all the health workers and everyone who made today possible. And it's my honor and a pleasure to be here. My name is Mansour Alilu Afui. You can call me the Mansu. I'm a spoken word artist. And once again, it's my honor to be here. So I will be performing a piece to you titled Too Many of Us. I hope you enjoy it. I know of too many women who never return. Haven't carried the weight of hope for 9 months. These women live to make space for your newborns. Our walls echo with the cries of new life and the loss of the young souls, the mothers who would never be. I know too many women whose journeys end only to begin another one, many without a choice to live or to die. Too many at the mercy of something sometimes bigger than us. One will, one pill, one push. Too many women who push and push, but still they never return. I know too many women whose bodies and soul bleed into one, their eyes shut. You could feel their veins pop through the walls of their skulls. Pain is the last strength that they draw. Fear is the last breath taken. Hope is the last dream they hold as they push and push all the love they've made, leaving their young bodies cold. There is too many of us. I know of too many little ones who would never trace the lines of their mother's smiles. They would never latch onto their mother's full breasts, and they would never taste the silkiness of their mother's milk. Too many who would never know what a mother's hands feel like. Too many whose hands they would never hold. Their birth stories may never be told. I know of too many children occupying the spaces that their mothers once held. Too many with their stories rewritten. Too many children from those same women who never return. So every time I hear another woman wailing, contracting, this pain excruciating, these tears burning to bring forth the new life, my heart breaks into a million pieces that the best doctors in the world could never fix. But today, I am pregnant with life, and with hope, my gaze travels through the cracked ceiling. A smile caresses my face. My lips whisper a little prayer for my soul, a promise for better days. Even though today's cries do not pierce through my window, they do not pierce through my ears, they live inside of them. I smile, hoping, praying. I smile, hoping, praying to not be another tally to the stroke of too many women who never return. I smile, knowing that there is hope. For too many are dying to hold on to all the love that they've made. For too many of us are graced with the silver lining of a better tomorrow, starting today. For too many of us who would return by one will, one push, one peel. There's too many of us who are willing and would stay and tell our stories, but with a different ending. Thank you.
Thank you. Beautiful, wonderful, full of hope. And that's why we're here today. Full of hope, building hope, making hope real. And it is on that premise that I'd like to invite the next very hopeful Nigerian. Initially, I thought Smiles for Mothers program was pushed and cheered by a woman until I saw the young man. And I would publicly invite you to my show, Uche, to come and speak of what motivated you to do this. So very proud of what you're doing. Dr. Uchenna Ubokwe has over 10 years of experience designing and implementing health systems strengthening programs. Uche is a principal at Solina Center for International Development and Research. And he's so many things, but for me, what is important is that he lives the hope of our tomorrow. He speaks to hope, and I believe in that for a better Nigeria where health systems would work, where our mothers would stop dying needlessly. Please put your hands together for Dr. Uche Ubokwe, Director of Smiles for Mothers Program, Principal, Solani Center for the International Development and Research.
Thank you so much, Auntie Moji. Introducing me, I feel proud of myself. Thank you so much. Excellent. Her Excellency, Chairperson of our occasion, and First Lady of Niger State, Dr. Amina Sani Bello. Her Excellency, Founder, Wellbeing Foundation Africa, Mrs. Toyin Saraki, the representative of the Honorable Minister of Health at this occasion, and Director of Reproductive Health, Dr. Kayode Afolabi, distinguished guests, our health workers present, permit me to stand on existing protocol. I'm going to spend the next 7 minutes speaking to you about the Smiles for Mothers program and the journey we've embarked on to get here today. Next slide. Let me start by sharing Nsisong's story. Nsisong lost his wife Fatima to postpartum hemorrhage, even though she attended her ANC and delivered at a health facility. She started bleeding 30 minutes after giving birth and died barely 3 hours after. All attempts to stop the bleeding with uterotonics failed. Now, Nsisong is left alone to fend for his 5-year-old son, Francis, and Destiny, his newborn daughter. He barely has enough to pay for childcare for Francis. So his mother, who also survives on very modest income from selling vegetables, helps with caring for Destiny. Ladies and gentlemen, when a woman dies giving birth, there are human, economic, and societal consequences. All are a price too high to bear. We have many of these cases. In many cases, every 2 minutes across the globe. We can do better. I won't bore you with the statistics. A lot of that has been said already. the situation is not where we want it to be. However, today we celebrate an opportunity that came to us because of the revised WHO guidelines on the use of uterotonics for preventing postpartum hemorrhage. That introduced heat-stable Carbetocin as a new uterotonic option in our toolkit, especially for our settings where the quality of oxytocin, which is the gold standard, by the way, for PPH prevention, cannot be guaranteed. The Smiles for Mothers program is one that builds on the efforts of government of Nigeria with the leadership of the Federal Ministry of Health and the 3 states, Kano, Lagos, and Niger, to reduce postpartum hemorrhage through the introduction and adoption of these WHO recommendations on the use of uterotonics. We're also using human-centered design to work with the states to also see what we can do to strengthen the health systems more broadly. This includes improving access to uterotonics, as well as quality maternal health care services at our health facilities. And I'll tell you how we do that in a moment. I have to start by congratulating our government. We couldn't be here without the strong leadership from Federal Ministry of Health, our state governments led by the different agencies, the ministries of health, the drug management agencies, primary healthcare development agencies, and hospital management boards. We also acknowledge the support from Ferring Pharmaceutical, represented here by my friends, Bav and Dr. Vishal, who enabled us to have this interesting and great innovation, heat-stable Carbetocin. Partners across the room, WHO specifically, as well as others, and professional associations like SOGON, represented here as well. It's really our honor, and there will be no Smiles for Mothers without you. Finally, is MSD for Mothers, the company with global initiatives to help create a world where no woman has to die while giving life, the founder of Smiles for Mothers program. We acknowledge all of your support. My next slide summarizes all we're doing on Smiles for Mothers. I don't know how visible that is, but we're embarking on a 2-year journey that is simple. The first year was to create a conducive environment for the implementation of these recommendations and introduction of heat-stable Carbetocin. We did by working with the Ministry of Health to update the normative policies, essential medicines lists, life-saving skills training manuals, and also obtaining NAFDAC approval for the importation of the drug, which we have in Nigeria today. In the second year and currently, we're embarking on training of health workers on delivering quality obstetric care, but also appropriate use of uterotonics. We're also working with the states to roll out patient literacy materials to improve overall wellness and care-seeking behavior of our mothers and communities. If they never get to the facilities, then in many cases, there's nothing we can do to save them when there's postpartum hemorrhage. On the supply chain aspect, we already successfully brought in heat-stable Carbetocin into the country. We have some doses for our clinical trainings, but also some implementation research, which we're commencing shortly. We're also expecting to seed the drug revolving funds with stock of heat-stable Carbetocin, which helps us establish a sustainable system for creating access to this drug at scale in the program states, but hopefully across Nigeria. We're also executing a very strong monitoring and evaluation and learning agenda with implementation research that is going to test and show us how our health workers interact with this drug at these facilities. We're conducting a cost effectiveness study to also help the policymakers prove the evidence of how cost effective heat-stable Carbetocin is compared to other uterotonic options. Armed with some of this information, we're embarking on strong local and global dissemination approaches using webinars, conferences, newsletters, but also this launch today. Our program for this year is going to support 87 health facilities train over 700 health workers. Regardless, we're only going to be able to reach 5% of the annual cohort of pregnant women in our supported states. Our intervention can only reach 100,000 out of 2 million. We're going to be only able to save a little over 900 lives. With that in mind, we are not the solution. We need to work with everybody to achieve scale. Only then can this innovation bring the change that we want it to do. My next few slides just show a few pictures of the work we've done with the Ministry of Health and States to update the normative policies. The next slide shows the arrival of heat-stable carbetocin in our states. We're very excited. That happened sometime in December of 2021. The next slide shows our patient literacy materials developed through human-centered design with the mothers themselves in communities in Niger, Kano, and Lagos, which is helping to raise community awareness and generate demand for uterotonics through these materials. Next slide shows us applying human-centered design and also training states to be able to apply these approaches to address other public health problems beyond postpartum hemorrhage in the future. The last program achievements slide shows our dissemination efforts, including a lot of learning sessions, which we've done with the states and other partners to learn from each other and continue to share some of those innovations. Permit me, distinguished guests, ladies and gentlemen, to summarize by saying that our plan is to achieve scale. We hope to use the evidence and our experience in 3 states in Nigeria, working with the Federal Ministry of Health, to scale to all 37 states and achieve rapid reduction of postpartum hemorrhage related maternal mortality in Nigeria. With that, I have a few asks of you. Her Excellencies here present, we urge that you continue to advocate to the governors, the government, the partners to prioritize resources for maternal health interventions, including funding and making sure we have available quality uterotonics, including heat-stable carbetocin. For the Federal Ministry of Health and our state government, we urge that you continue your efforts to lead these PPH reduction initiatives and ensure access to quality uterotonics, including heat-stable carbetocin, using your drug revolving schemes and other approaches. We urge that you also share the lessons that you learn with other states to drive scale up of these initiatives. Donors and development partners, we urge your support for the adoption of WHO guidelines for the uterotonics for PPH prevention and introduction of heat-stable carbetocin in the geographies where you work across Nigeria. We also look to continue to thought partner and synergize with you as we continue along this journey. Distinguished guests, we solicit your support in creating a Nigeria where no woman has to die while giving life. Thank you for the time, and we're honored to have you all here.
Good morning, everyone. Distinguished guests, Your Excellency, First Lady of Niger State, Dr. Amina Bello, Your Excellency, Mrs. Toyin Saraki. Ladies and gentlemen, it's an absolute privilege and an honor to be with you here today. to mark a very important and historic occasion. We have two very important religious events running in parallel with Lent, Ramadan. It's also World Health Day today, and what an auspicious day to mark such a historic occasion. I'm Bavin. I head up the Safe Birth Project for Ferring, based out of Switzerland. It's also my first trip to Africa, so I'm really humbled and privileged to be here. My roots are, my mother was actually born in Kenya, so this is an absolute privilege to be here today. So yesterday I had an opportunity to join Your Excellency, Mrs. Saraki, to visit a hospital here in Abuja. This brought home to me how much progress has already been made to tackle PPH. Seeing the busy maternity wards, the lots of newborn babies, and the collaboration between the healthcare teams reminds me of the team spirit that we must create in society to tackle the challenge of PPH. That's why I'm proud to announce today that we now have an effective tool in the toolbox for our healthcare professionals to combat postpartum hemorrhage, the leading cause of maternal deaths here in Nigeria. It goes without saying, family holds a special meaning in all of our hearts. The reason why I say this is our purpose at Ferring is to build families and to ensure that no woman dies giving birth. Today's milestone is a major step forward in ensuring that we play a major role in reducing inequalities in maternal health. As I'm sure you can imagine, the pandemic has put significant pressure on our healthcare systems. Latest research from the Johns Hopkins University reveals that there could be an increase of 40% of maternal deaths as a result of the pandemic, hitting the most vulnerable the hardest. For us, every person should have the right to build a family. That's why in 2013, Ferring, together with the WHO and MSD for Mothers, collaborated to develop and make available a heat-stable formulation of Carbetocin. On behalf of the team, I'm pleased to say that we've been able to do this. We have now also committed to making heat-stable Carbetocin available at a sustainable access price in the public sector of over 80 low and lower middle income countries around the world. This is a commitment that we do not take lightly, and it is a commitment without an end date. Our company has set a goal to protect the lives of 20 million women and their families by 2030 through the sustainable access to heat-stable Carbetocin. With quality assured manufacturing, enough capacity, because I know that's sometimes a worry for many of you, we're pleased to say that we're both able to manufacture and supply this important treatment. I would like to express our thanks to the WHO, MSD for Mothers, for their support and collaboration, without whom this would not have been possible. In addition, I would like to offer my sincere thanks to the researchers, midwives, obstetricians, and doctors from the Champion study. You know, I just want to take a moment. It's a round of applause for everyone, all the healthcare professionals once again in the room. And also a huge special thanks to the Smiles for Mothers team for their dedication, their excellent work, as we just heard, to implement the use of heat-stable Carbetocin here in Nigeria. We want to continue to work with healthcare professionals to collaborate and to ensure that together we can save lives. We can make a difference. They say, if you want to go fast, go alone. But if you want to go far, go together. The team at Ferring want to go far together with you and ensure that with your support, no woman dies giving birth. With that, I would like to introduce my colleague in a moment, but over to the host, Dr. Vishal Shah in a moment. Thank you.
Right. Thank you very much. Yes, you please can come on. Thank you so much. And I like that part, that together we'll do it better and go further. Dr. Vishal Shah's presentation is on the introduction of Carbetocin for PPH prevention. Thank you. You have the floor, please.
Good morning, everybody. Thanks a lot, Bhav, for giving those introductory remarks. It's my pleasure and honor to be a part of this occasion for the launch of heat stable Carbetocin in Nigeria. And as Bhav mentioned, even my too is a first visit, and it's really pleasure to be here on this soil, and that too on this holy month, I would say, because it's Ramadan. It was a Good Friday, and even for the Hindu also, there is Lord Mahavir Jayanti's birth ceremony also. So overall, I would say the April month is a holy month for all the religions. I'm here to present the role of heat stable Carbetocin in the prevention of the postpartum hemorrhage. And as everyone has said about the PPH and the burden, the mortality rates, so I'm not going to repeat all those points. Can I have the next slide, please? Okay, yeah. But yeah, the PPH, definitely it has a lot of impact on the family. It has an impact on the psychosociological. It has an impact even on the, what you can say, on the brain also. So overall, it has a lot of burden of PPH, not only on the mother, but also on the family. And the most important thing that the PPH, which is basically because of the uterine atony, it's preventable. But oxytocin, which is the gold and the current standard of the treatment for the prevention of the PPH, it's basically not stored appropriately in the cold chain storage condition. It requires around 2 to 8 degrees centigrade, but because of the lack of infrastructure, because of the lack of electricity, because of the power issues, the drug is not being properly stored. And hence, it's an opportunity to introduce heat stable Carbetocin for the prevention of the postpartum hemorrhage. So, thank you. And that's where the first milestone began, as everyone has mentioned, that Ferring introduced heat stable Carbetocin, which was an innovation which was basically required for the prevention of postpartum hemorrhage. So in 2013, this unique public-private partnership began. MSD for Mothers and Ferring approached WHO to conduct this largest ever trial, that is including 30,000 women. This was one of the largest ever trial which began in 2015, where WHO had set 3 important parameters. First one was to look at the non-inferiority of oxytocin versus Carbetocin after vaginal delivery for the prevention of the postpartum hemorrhage. Second one was by the intramuscular route. Please remember, before that, there was no trial which was being conducted by the intramuscular route. But this was one of the first ever trial which was being conducted by the intramuscular route, so that the healthcare workers can easily administer it. And the third one was to include into the WHO essential medicine list. So the WHO trial, which was basically the largest ever trial which was being conducted, it was a double-blind, randomized, active control by using heat stable Carbetocin for the prevention of the postpartum hemorrhage after the vaginal delivery. The conclusion of the trial was that it met the primary objectives. One, there was no requirement of the additional uterotonics, and second one, that it reduced the blood loss, which was more than or equal to 500 ml. So that was the second milestone which was being achieved with the introduction of heat stable Carbetocin. The third one was that after this particular trial, the WHO had to revise their guidelines, and then they included heat stable Carbetocin for the prevention of postpartum hemorrhage into their guidelines. So that was one of the third milestone which was being achieved. The fourth milestone which was being achieved by heat stable Carbetocin was to include into the WHO essential medicine list, which was being done in 2019. So my dear friends, the clinical value benefit of heat stable Carbetocin is that it's basically one of the highest ranked uterotonics for the prevention of blood loss more than or equal to 500 ml. Second, by reducing the need of the additional uterotonic drug. Third, it has a safety comparison with that of the oxytocin. The fourth one is that, as my previous speakers mentioned, it's the only single uterotonic which is reliable, and it can be given as a single standard dose, and it can be stored at 30 degrees centigrade. We do have some evidences which the drug can be stored at 40 degrees as well as at the 50 degrees. So that's the benefit what heat stable carbetocin can give to low and lower middle income countries. So these are some of the value benefits what heat stable carbetocin can give. In terms of the dosage, as I mentioned, it's a one single dose which can be given, and especially very, very important to all my healthcare professionals as well as to the frontline workers is that the drug can be given by intramuscular route. The drug can be given by intravenous route. By intravenous route, it needs to be directly given into the IV port. Please remember that. And it need not to be diluted. It's an undiluted form. Please remember that's very, very important for all the healthcare professionals. And intramuscular can be given by the local protocols. So these are some important points which one has to remember. In terms of the contraindication, the drug should not be used for induction of labor or for augmentation of the labor. So please remember, these are two important points. And at the moment, we do not have any evidences for the management of postpartum hemorrhage. And also we do not have any evidences for the additional dosages of heat stable carbetocin. So we have only evidence for as a single shot for the prevention of postpartum hemorrhage. So that's very, very critical and important so that everyone should remember. Now, lastly, to summarize the drug, it's already being recommended by the World Health Organization. We have evidences on the efficacy. We have the evidences on the safety parameter. It is a single shot which is being available. And thanks a lot for my previous speaker that he showed the pack shot, and the drug is already being approved by the regulator bodies. Lastly, I just want to say that the drug we are going to introduce into the low and the lower middle income countries at an accessible and a sustainable price. The drug is already being registered and approved in almost 9 countries, and Nigeria is among that one of the country where we already got an approval. And we are also in the process of WHO pre-qualification. So that's something which is parallelly happening. And because of this, the drug approval will get expedited. So that's the advantage. And we are also working in some other low and low middle income countries to achieve the registration. So these are some of the important milestones and the landmarks which we have achieved by introducing heat stable carbetocin. And thanks a lot for your patience as well as for listening to me. Thank you once again.
Thank you very much, Dr. Victor Shell, for that, should I say, assurances, speaking to potency, speaking to the value added, and of course, the practicality of the usage and how it will help to reduce what we are witnessing today in terms of postpartum hemorrhage. Just quickly, I'd like to remind you that if you check in your folder, you would find this publication. It's important for you to read about it so that you understand, have more understanding of what SMILES is doing in terms of ensuring the reduction of maternal mortality in our environment. There'll just be a short video clip here for you now before we continue with the program. Can we have it, please?
There's so many PPH cases in this hospital. Some of them, they used to come after delivery, and some they used to develop PPH in the hospital. Despite all the oxytocin drugs we administer to the patients, oxytocin 10 international units, it won't work. You have to give 40 international units in a liter of IV fluid. They will still bleed after all these interventions, as if the drugs are not very effective. The death of a patient is very disheartening. You find out that a patient will just come to you, you attend to the patient, be attending to the patient, going up and down with the patient, and at last you lost that patient. You will not like it at all.
Gado in kwanta ba gado, ni na dawo ƙasa, a nan dai na kwanta, shi ne jini ya yi ta zuba, yana ta malala. 'Yan uwana da suka zo ana saka yana zuba. To dai a nan wajen dai na kwanta a kusan 12 rana, tun wajen ƙarfe 6 na yamma a wajen 12 yana nan. A ana je gugurwa suka ce in tafi Murtala, shi ne in tafi Murtala, daga Murtala ne kuma abin ya ci gaba.
Champions Trial is a clinical trial organized by WHO, the largest clinical trial on postpartum hemorrhage, about 30,000 women. Champions Trial looks into alternatives or drugs that are very effective and comparable to the standard care, testing whether the heat stable carbetocin is not inferior to the standard care, which is oxytocin. It was conducted in 10 countries using 23 centers, in which Nigeria was lucky to be part of those 10 countries, and we had 2 centers, Mother and Child Hospital, Akure in Nigeria, and the University College Hospital in Ibadan. Heat stable carbetocin needs to be heat stable because the standard care, which is the oxytocin, require a cold chain from manufacturer to the end user. By transporting it, it must be in a cool van and maintaining a temperature of 2 to 8 degrees centigrade. This is not usually available because most of our deliveries are either in remote hospitals or areas where we cannot maintain constant electricity to keep those drugs at that temperature. That is the advantage heat stable carbetocin had over the standard care. If it is made available to our women, this will reduce maternal mortality to a barest minimum.
Smiles for Mothers program and MSD for Mothers that seeks to reduce maternal deaths due to postpartum hemorrhage. We're working with 3 state governments in Nigeria, Lagos, Kano, and Niger, as well as collaborating with the Federal Ministry of Health to implement innovations across the 3 states to reduce postpartum hemorrhage. It's very consequential, especially in our setting in low middle income countries, because included a new entrant, a new drug into the uterotonic mist. That is heat stable formulation of carbetocin, an oxytocin analog, but was also found in trials, for example, the Champions trial, to have very similar efficacy with oxytocin in preventing postpartum hemorrhage. The game changer here is that it can be stored at ambient temperatures. Heat stable carbetocin provides or bridges that gap, where in facilities where we can't guarantee the quality of oxytocin, heat stable carbetocin becomes a very viable option for preventing postpartum hemorrhage.
You go on supervision, and unfortunately you may find oxytocin vials on the counter where they should not be placed. And these are some of the challenges we are having with the management of PPH in Kano.
We believe the heat stable carbetocin will give a better result, because you will be sure of the quality you are giving to the pregnant mothers as far as prematernal and child healthcare intervention is concerned in the state. So we are really happy with this introduction of this new knowledge.
We're undertaking series of trainings with health workers so that first of all, they are reacquainted with the acute management of third stage of labor more broadly, but then also understand the implications of having new options for uterotonics. Secondly is about the supplies. We also worked with IDA Foundation, Ferring Pharmaceuticals representative in Nigeria, to work through getting approval to import the drugs, clearing the drugs, and actually delivering them to the state medical stores to make sure the financing to keep it coming is sustainable. We worked with Ferring to donate a seed stock of the doses, which was also very excellent in terms of their contribution to helping Nigeria reduce maternal mortality. We got over 69,000 doses as seed stock, and it is distributed between Lagos, Kano, and Niger states.
The first use of heat-stable Carbetocin was actually amazing. I used a 2 cc syringe and I was able to take the 1 ml from the vial. And then I was able to put it in the arm of the patient. And it wasn't painful because there was no sign of pain, on the face of the patient. And immediately after giving the heat-stable Carbetocin, I saw that, the uterus was contracted. And then it was so simple to deliver the placenta with a controlled contraction. And after that, there was no bleeding at all. And the patient was very happy.
This heat-stable Carbetocin, I'm really impressed with it. It's very effective. Immediately it was administered to a patient. I checked on the uterus to see whether it has contracted or not. To my surprise, the uterus really contracted.
There is no doubt that we need an effective oxytocin to save the over a quarter of women that die from postpartum hemorrhage. Having an oxytocin that is actually heat stable, which means we don't need a refrigerator. We can keep it close to the patient when she's going to deliver, and then we can quickly administer it within a minute of delivery so that we can save this woman from dying from postpartum hemorrhage. There is no doubt that there is the need that we make heat-stable Carbetocin available to the women in low middle income countries.
I have high hope that this heat-stable Carbetocin will really prevent PPH and at the end reduce maternal mortality in our country and in the world at large.
I was actually looking at body language while the video was on. I like the fact that the professionals themselves were nodding to it. And I kept praying in my mind that God, it won't be just here. It won't be just 3 states. It will be all over, hard to reach area, wherever. And I think we should start thinking of other strategies that can actually buy in more partners who will be able to distribute the medication where needed, so that at the very lowest of health facility, there can be this medication to change life. Thank you. I think another round of applause for that one. And speaking of what at least the evidence is that we saw in that video, I was also informed that one of the primary investigator for the Champion trial that birthed the inclusion of HSC in WHO recommendation, Dr. Olorunfemi Owa is here with us. Please, can you take a bow, Dr. Owa? I was told he was here. Right. Thank you so much. Yes, thank you. Well, and yes, we have here the woman who dared, to administer the very first dose. She's here with us evidently to demonstrate the fact that it works, and she did it. So again, I'd like to recognize Professor Galadanchi. Please, can you rise so that we all see you? Thank you so very much. At the moment, we're going to have a special recognition for the first woman to receive this medication. She's been represented today by Dr. Anifa. Yes, Dr. Anifa. Thank you. Please, can you come forward? Yes. Dr. Anifa is representing that woman who is alive today. Yes, she is. And at this moment, I'd like, please come to the podium. I'd like to invite the chairperson of today's event and the First Lady in Niger State, Dr. Amina Sani Bello, to please give this special award to the first woman who dared, to come forward. Thank you.
So on behalf of Smile for Mothers and Fairing, the Smile for Mothers and Fairing Pharmaceutical presents this special award to Aisha Aminu in recognition as the first patient to receive a dose of heat-stable Carbetocin in Nigeria and Sub-Saharan Africa today on the 7th of April, 2022. Congratulations. Thank you.
SD, and of course from Smiles, members of this table, and the director from the Federal Ministry of Health. Can you come up, please? Can you please all come up while we have the chairperson unveil the HSC. Adebisi would need your, can I please have you here for some coordination? Thank you. Yes, please. Yes, Sogon. Yes, Sogon, very important. If you ask me, I would want to invite the Deputy Director of Nursing from the National Hospital. And I think, let me see how the stage is looking. Thank you. Okay, yes, please, Doctor, you can leave after collecting the award. Thank you. Thank you so very much. So I would hand over the microphone to you while you unveil this hope.
Are we cutting it off? Okay. So today, 7th of April, 2022.
So we're off now. Today, April 7th, 2022, on behalf of Smile for Mothers and Ferring Pharmaceuticals, this is a very historic day where we will unveil for the first time and launch heat-stable Carbetocin for the prevention of PPH. And I do this with all pleasure and humility and pray that this is something that will make a difference to the women in Nigeria and Africa at large. So for the benefit of Nigeria, Africa at large, I cut this. Can you hit this?
No woman has to die given life. This is what has been demonstrated here today. And with this innovation, can we please put our hands together one more time? Wow. Like Her Excellency said, we hope that this will be a countdown and count out of women who will die as a result of PPH. We'll take this picture. Members of the high table, please, you will stand while I'll invite some other people to join you for another picture, particularly representatives. So please, my colleagues, can we have a quick photo ops of this? Thank you very much. Yes, are you okay with this? Thank you. We have a second leg of the pictures. Please, Uche, can you go back? Yes. I'd like to invite Dr. Vishal, you're here. Representatives from Kano, Lagos, and Niger, and representative from NAFDAC. Can you please join NAFDAC? Lagos, Niger, and Kano. WHO, very important, IDA. Thank you, our director from the Federal Ministry of Health. Dr. Anifa? Dr. Owa, please. WHO, NAFDAC, all represented. Now watch. Thank you for being here. Thank you very much. Thank you very much. Can we settle down? Can we settle down, please? At this point, I'd like to invite pharmacist Wad Inobi to give the closing remark. Pharmacist Wad Inobi to give the closing remarks, please.
Let's settle down. Let's settle down. Our day is fast spent, but we must all agree that we have done justice to the assignment of the day. So my name is Nwebi Nwadinobi. I represent IDA Foundation in Nigeria. IDA Foundation is an independent social enterprise. We supply essential medicines and healthcare commodities to different countries around the world, over 130 countries. And at the center of what we do is quality. Hello? At the center of what we do is quality. In the past 15 to 20 years, we have been supplying essential medicines to various villages. I'm sure that I've been to over half of the villages of the people here, supplying essential medicines. And the new addition to that list is his stable Carbetocin. I have one more statistics to give. I'm sure we have already taken a whole lot today. And that statistics is in last 5 years, thereabout. The USP, United States Pharmacopoeia, conducted a survey in partnership with NAFDAC. That's the NAFDAC representative, you're welcome. And what did they find out? They took oxytocin, they sampled 200 oxytocin from various manufacturers across the country from the 6 geopolitical zones. And when they analyzed them, they found out that they had 73.5% failure. 73.5% failure. And NAFDAC, we started wondering what could be the problem. And NAFDAC went through their records and they found out that all the oxytocin that were brought in at a very good potency. So we realized that something that happens in the distribution. So we have said everything here. The storage is a problem, the power, the remote villages. So we thank the ferrying team and all the implementing partners for this wonderful initiative. It's something that is heartwarming to every one of us. So Her Excellency, the wife of the governor of Niger State, Her Excellency, the wife of Kola Saraki, you are welcome, and all the distinguished guests here present who have said it all. It's good that we have done this with these 3 pilot states, but we have an assignment now to take it to the rest of the states. We have 33 more states and FCT. How do we take these drugs to them? It's our responsibility as a foundation. We are the custodian of the drug in Nigeria. I'll be coming to your clinics. I'll be needing the help of our
very amiable First Lady and the wife of Bukola Saraki. If you give me your contacts, I'll be very glad to have them so that we'll see how to scale this up to other states where they are needed. Thank you very much for coming. And I will not forget to say that Mansu almost brought tears out of my eyes when she was going through that poetry, because I'm one of those that lost their mom when I was a baby. So when she went about how your mother carried you, I have no picture in my head. And for reasons like that, I have made up my mind. This project is the closest to my heart. I will go to the nook and crannies of this country, making sure that his stable Carbetocin is placed in the clinic where every woman that needs it for delivery is giving birth. But I will need your support to do that. So let's put our hands together for Ferrin. And the rest of the team, MSD for Mothers, Smile for Mothers. Mr. Ibokwe has done a beautiful job. Well, thank you. It's very pleasant working with you and your team and all the implementing partners. But let us always remember that our job is not done yet. As you leave this place, we hope and pray that the Lord that brought you here will take you home safely, and that as we do that, we'll continue to do the good job that we have started. Thank you very much. It's nice to have all of you here.
Thank you very well. Thank you so very much. We are drawing the curtain, but before we do that, I do hope that as we begin to distribute this wonderful hope giver, lifesaver, it will not only become accessible, but it will be affordable, and it will reach every nook and cranny of Nigeria and indeed Africa. We're moving on. We started with God. We want to wrap it up with his presence and give him all the glory that he deserves. I'd like to call a representative from Lagos State who will give us the closing prayer. I just dropped her name now, and I'll go call that name. The representative from Lagos will give us the closing prayer. Pharmacist Simisola, yes, Okpanuga. God bless you. Let's rise as we pray. We thank you, Father, for this day. Thank you for the opportunity. Thank you for the deliberations here. Thank you for journey mercies. We give you all the praise. Be thou exalted in the name of Jesus. Father, we pray that as we all go back to our various destinations, we continue to be light in our corners, saving lives in the name of Jesus. We receive journey mercies for everyone. In Jesus' name we pray. While we're standing, can we together sing the national anthem after the count of 3? 1, 2, 3. Thank you very much. Have a wonderful day in Abuja. For our Muslim brothers and sisters who are fasting, there's a package for your lunch. And for others who are not fasting, Acacia restaurant is opened for you. Please, if you go out there, the package will be given to all sisters and brothers who are fasting. And for those who are not, Acacia restaurant is where to find your way for lunch. Have a good day. Acacia Hall is within the premises here. Find it, that's where to go for lunch if you're not taking a packed lunch.